Thank you, Mr. Speaker. This morning, I attended the Momentum Mental Health Awards, honoring those who've helped end stigma that prevents many from seeking help. And indeed, stigma against mental illness can drive some to self-medicate through substance use. Yet, while the Leader of the Opposition yesterday expressed concerns about access to treatment, he also continues to spread stigma about individuals who access life-saving supervised consumption sites, having referred to them as addicts who inject poison into themselves. To the Associate Minister of Health, alongside providing funding for those life-saving health services, what steps are you taking to end stigma by pushing back against such life-threatening misinformation?
The Associate Minister of Health.
I'd like to start by thanking the member for his advocacy on this important issue. Mr. Speaker, stigma kills. Stigma prevents people from talking openly about mental illness and substance use, and stigma prevents people from accessing the help they need. I'm so proud of the work our government has done to make supervised consumption services available in Alberta. In Calgary, there have been more than 10,000 visits to the Schumer site since it opened, and almost 200 overdoses have been reversed. Behind each reversal is a person with value who deserves to be treated with dignity and respect, who has friends and family who care about them, and now they have another chance to find help.
For supplemental.
Thank you, Mr. Speaker. Given that stigma is also one of the reasons that many LGBTQ2S+ youth struggle with their mental health, and given that studies show GSAs save lives by offering them safe spaces with peer support free from judgment, and given that the opposition leader and UCP MLAs have contributed to harmful stigma against them by repeatedly suggesting GSAs teach secret curriculum on sexual subjects, to the Minister of Education, what steps are you taking to push back against such life-threatening misinformation?
Well, thank you, Mr. Speaker. And as you know, GSAs literally do save lives in schools and outside too. I've visited a number of these GSAs around the province, and I've heard that message loud and clear from students. For that reason, we passed Bill 24 into law this past fall, and I was definitely disappointed that we did not get unanimous support for that. The opposition did vote against it, and then brought forward policy that would reinforce the destructive elements of on GSAs. And so I was very disappointed, but certainly our government is here to protect kids. They know that, and students should feel safe and welcome.
Thank you, Honourable Minister. Proceed.
Thank you, Mr. Speaker. Given that women have long faced judgment and stigma simply for insisting on the right to control their own bodies and reproductive decisions, and given members of the opposition refuse to even engage in discussion on ensuring they can exercise that right with privacy, safety and dignity, and given that the majority of their party members voted to strip that right from young women old enough to drive and work a part-time job, to the Minister of Health, what steps are you taking to ensure all women in our province can access this safe, legal health care service?
Minister of Health.
Thank you very much, Mr. Speaker. This government stands with women, and we believe strongly that women's rights are human rights and that their right to make their own decisions is not up for debate. The members opposite showed what their beliefs are at their convention, but they won't stand up in this chamber and state their beliefs for Albertans. On this side, we welcome every day all members of this House to stand up for Albertans. This side of the House won't stop doing their work to protect the things that matter most to Alberta families. Thank you.